Hi there. First, thank you very much. That was a very nice comment. Not having a lot of testosterone isn't really a good thing. Not having enough can cause health issues. I hope it doesn't cause you any issues, though. I appreciate that. Kathy Poo Poo, I thought I'd talk a bit about the associated health risks with transgender care and where I stand with it. So basically, when I go in to see the endocrinologist, my hormone doctor, I had to sign what's called an informed consent form. This is the page from the informed consent form that I have to sign that has like everything in it. So the benefits and the risks. So it says you can cause harm the liver, increased risk of blood clots. The risk can be increased if you smoke or overweight. Side effects of having the low testosterone are down here at the bottom. It says you may feel less sexual. You may not be able to get erect for You probably won't have as much when you So I'm well aware of the risks. When the doctor told me that my testosterone was low, obviously I wanted to know what the risks of that potentially were as well. So I looked up the symptoms of low testosterone in women, and basically this is what I came up with. Low sex drive. These are desired effects for me. I prefer to have a lower sex drive. So it's like treatment for my gender dysphoria. That helps with my gender dysphoria. So that's why I take these medications, as it's all to alleviate my gender dysphoria. So there's an acceptable amount of risk that I will take, that I'm willing to take, or that all transgender people that take the cross-sex hormone therapy essentially have to take in order to take the cross-sex hormone therapy. Basically, the potential benefits for me outweigh the potential risks and side effects. So the rest of this, going down, lack of energy, I can definitely relate to that. I have 2 different accounts on this platform. My other account is sim racing, and if you ever watch me as a sim racer, occasionally I will be going to these yawning fits where I'll just yawn really hard, and it's because my testosterone's so low, and I get really, really tired. I do it at work sometimes too, and I'll just go into these uncontrollable yawning fits. Loss of strength and muscle tone, that's a desired outcome for me personally. Infertility or trouble conceiving, that's something that literally every single trans person has to accept if you choose to go through the cross-sex hormone therapy and or the surgeries. Irregular menstrual cycle, don't have one, so don't have to worry about vaginal dryness yet. Anyways, I don't know if that would be an issue after the surgery or whatever. Depression or anxiety, I had depression and anxiety before I started. It has actually helped to alleviate it, but I still have anxiety, which I manage with another medication. Thinning hair, so my hair started thinning when I was 17, 18 years old, if I'm being real. So I have left what I have left. Dry, brittle skin, it's definitely something I can attest to. So my skin is super fragile, breaks really easy, I bruise really easy, and my legs, especially if I don't use lotion, can get really dry. Trouble sleeping, I personally don't have trouble sleeping, so I don't have to deal with that effect personally, but I do have go into these, like I said, occasional yawning fits where I can't stop yawning. I could potentially take less of the testosterone blocker and deal with this stuff, but no thank you. I'll pass. So for me, it would make my voice even deeper. It would make my body hair grow more, which I don't. My body hair all stopped growing, and I kind of like it like that. And I don't need any more MPV. And I'm good on acne too. You guys can keep the acne, thank you. The bottom of this article that I found, this is all from the same article, note from Cleveland Clinic. Testosterone is a hormone typically associated with men, but women also need testosterone. Low testosterone may cause several symptoms. If your levels are low, it could affect other hormones in your body and cause you to feel disinterested in sex or be extra tired or weak. Testosterone also affects your menstrual cycle. Your healthcare provider can evaluate and perform any necessary blood work. Some treatments for low testosterone exist, but they aren't approved by the FDA and come with risks. Don't start testosterone therapy unless you've talked to your provider and carefully weighed your options. Okay, so as far as it affecting other hormones in my body, my hormones are regulated with a weekly injection and pills. So my hormones are being regulated chemically. So I don't have to worry about it as far as being disinterested in being in sex or feeling extra tired or weak. I've already said yes, I do feel extra tired sometimes. It's hard sometimes for sure. The weakness too, that's hard sometimes too. And the disinterest in sex, I'm fine with. Like, I'm good with that. There are literally more side effects and worse side effects on this bottle of generic Excedrin. Acetaminophen may cause severe skin reactions. Symptoms may include skin reddening, blisters, and rash. Aspirin may cause hives, local swelling, asthma, wheezing, or shock. Liver warning. Severe liver damage may occur if you take more than 8 tablets in 24 hours, which is the maximum daily amount with other drugs containing acetaminophen. Stomach bleeding warning. This product contains a NASID, which may cause severe stomach bleeding. I'm not trying to what about, I'm just saying, like, this has more risks than anything that I'm doing with, like, the cross-sex hormone therapy. So, anyways, that's all for this one. I hope you have a great day. Thanks. Peace.